This is the most common. Water.
Yeah, exactly. I don't know. It's really important. I don't know.
That's a good moment for me to tell people to please silence their phones. Good morning. I'm Dennis Clements, the Interim Director of the Global Health Institute. It is my distinct pleasure to welcome you to our 2022 Global Health Graduate Student Commencement Ceremony. Today, we are honoring 37 students who are earning their Masters of Science in Global Health. This is a very special class and a very special achievement, and we are so proud to be recognizing all of our students' efforts, their hard work, and their resilience. I'd like to welcome the families of our graduates, those of you who are with us in person, as well as those of you within spirit and also watching online. This is your day too. You have been there throughout this journey to cheer on your graduate, to motivate them, to encourage them, or even just to be understanding listener at a critical time. And who of us hasn't needed that in these past 2 years? Thank you for entrusting us with teaching and supporting your loved one, and for all you have done to help them reach this day. I also want to thank our faculty and staff, many of whom are here today. 2 years ago, COVID-19 forced you to change pretty much everything you were doing, to reinvent on the fly how you teach, conduct research, and mentor students. You did that, but most importantly, you always put the education experience and well-being of our students first. And I know you could not be prouder of the way these graduates have responded to all those challenges. In particular, I want to recognize the extraordinary effort of our education team led by Mary Story, our Associate Director for Education Programs, and Nathan Thielman, Director of Graduate Studies. The members of this team, Laura Bai, Sarah Martin, Lisa McKean, Kate Sullivan, Alexis Kesenick, and Shania Parker, do so many things every day in support of our students and our program. And we would literally not be here today without their incredible efforts including bringing flowers to the stage. But graduates, let's talk about you. You did it, you made it. And for all your hard work and diligence it takes to complete a graduate degree under the best of circumstances, you had to do it in some of the worst. 2 years ago, you took a chance, you signed up for a global health program in the middle of a global health crisis. That showed your courage and your willingness to accept uncertainty. But most of all, it showed your resolve to be part of the solution. Your time here was not what many of us expected it would be, but you not only accepted the realities of learning in a pandemic, you embraced them, you still found ways to connect, forming deep friendships with peers that in many cases you had not yet met in person. While most of you were not able to travel to conduct field research, you engaged with your global collaborators as you were sitting across the table. You changed your research plans and still managed to pull together posters in time for showcase. You wowed your mentors with your thesis, papers, and your defenses, and asked for help when you needed it, and gave help when you had it to offer. And though the circumstances weren't anything we wished for, they gave us the opportunity to see your strength, your compassion, and your great care for one another. You're going to hear a lot from our speakers today about the resilience and the adaptability these graduates showed during their past 2 years. And they deserve every bit of our praise and admiration for the way they handled the many, right page, obstacles they have faced. They have tested, and not just in the classroom, but every day, and they have passed with distinction. And so graduates, I will say it again, you did it. You can now count yourself among the generations of scholars and leaders who graduated from Duke University. We hope we have prepared you well for the opportunities that await you, and we can't wait to see what you do next. Please stay in touch. On behalf of the DGHI faculty and staff, your families and friends, our global partners, and all those who look forward to this day, I congratulate you on your graduation. In a moment, you will hear from our selected speakers, but before I introduce them, just a few housekeeping details. First, we do have an audience watching online. Just a few housekeeping details. We have watching online, and so I'd ask you to silence your phones, like I just did. And please try to keep the middle aisle clear when our students are walking across the stage. Also, immediately after the ceremony, we will be taking a class photo. So graduates, please follow the education team outside to the patio once we are done here. Families, please feel free to enjoy the reception in the atrium, and your graduates will join you right after the photo. Now I have the great pleasure of introducing our next two speakers, one faculty and one student. They were nominated by our graduates to reflect on the class and its extraordinary achievements. First, we will hear from Joe Egger, who is the Associate Professor of Practice in Global Health. Following Joe will be one of our students, Noor Hamad. Joe.
Phew. Good morning. So wonderful to be here. It's been too long. Welcome again to family, to friends, to loved ones, to DGHI Director Dennis Clements, to our Associate Director of Education, Professor Mary Story, to our Director of Graduate Studies, Professor Nathan Thielman, to all of my DGHI colleagues, and most especially to our students. Again, my name is Joe Egger, and I am a faculty member here at the Global Health Institute. I've had the privilege of getting to know these 37 graduate students over nearly 2 years. I'm so happy to be here today to share in the joy that this day brings and to help you celebrate this truly meaningful accomplishment in your life. Earning a master's degree at Duke in global health is a great achievement in any year. But I would be remiss if I didn't spend a few minutes acknowledging what this class, what you, have been through over the past 2 years. I imagine you're going to hear a lot about COVID today. hopefully this will be the end of it. So I'd like to rewind and remind ourselves where we all were 2 years ago. As we all know too well, the spring of 2020 was the beginning of what was to become the greatest global health crisis of the past 100 years. Probably the most significant social disruption, at least globally, since World War II. And right at the beginning of all of this, you were accepted at Duke University to pursue a graduate degree in global health. I would imagine that most, if not all of you, decided to attend graduate school in global health before the COVID-19 pandemic began. Life is unpredictable. You had choices to make. For example, in early 2020, a few of you were evacuated from Peace Corps postings or other international positions. Was this really the best time to go to graduate school? Maybe the start of this pandemic 2 years ago strengthened your resolve and decision to pursue a degree in global health. But if you're anything like me, it probably made you a bit anxious and gave you pause. So what did you do? What did you do in the face of this uncertainty about the state of the world? In the face of anxiety and fear? Well, you showed up. And showing up under great uncertainty takes courage. You prepared yourself to start graduate school, not being sure what graduate school was going to look like, probably what it even meant to go to graduate school. Most of you are not from North Carolina or even the southeastern United States. 10 of the 37 of you are international students, where English is likely not your first or native language. But you still showed up. I attended graduate school internationally as well, and I remember how exciting but also how terrifying it was to walk up the steps of my school on that first day. And that first day wasn't right in the middle of a public health emergency. Okay, so why talk about all of this when we were all tired of talking about COVID? Well, in my 20 years of global health research, I think there are two qualities in a person that above all else dictate success in global health research and practice. Those two qualities for me are adaptability and perseverance. Our work is challenging. We do human subjects research in conditions that are less than ideal, in populations who are often under great distress. Being successful involves being able to adapt to our environment and to persevere through difficult situations. The last 2 years have seen their fair share of difficult situations. I don't have to tell you that. This class, you have not only endured, but you have thrived. And this started by showing up. You moved to Durham, you moved into new houses or apartments. You might have asked yourself questions like, was I going to go to class in person? Do I know how to use Zoom? How often was I going to Trent Hall? Where was Trent Hall? Is this Trent Hall? Was I ever going to meet my academic mentor in person? But despite this uncertainty, you showed up. You showed up on Zoom, and then you adapted, and you showed up in person in masks. In the nearly 2 years I've known you, I've never had one student complain about being on Zoom. Not one of you ever complained, at least to me, about wearing a mask in my classes. I got to know you in January of 2021, when you were invited, strongly encouraged perhaps, to attend my statistical programming course over Zoom. And I know what your friends and family are probably thinking, wow, that sounds really fun to take statistical programming over Zoom. Hopefully we had some fun, but it was a challenge. You didn't complain about it. Not only that, for pretty much the first time a number of you decided to teach yourselves a separate statistical programming language than the one I was teaching you over Zoom. That is truly impressive. And you adapted. If you were not familiar with the phrase secondary data analysis before you got to DJHI, you probably are now. You pivoted from field work that you were planning and hoping to do in another country to working in our local communities. You recognize that health equity is an issue in East Durham as well as in East Africa and South America. And through the difficult times, you never stopped asking yourselves tough questions and challenging yourselves and others to do better. I had the pleasure of working alongside a number of you on committees that began to address racial equity in our curriculum, both in our classrooms and in experiential learning. You forced me, us as an institute, to reckon with racial equity in our teaching, even in our epistemologies, or how we know what we know and why we believe what we believe. I believe that because of this, we have begun to be more thoughtful and nuanced in how we perform health equity research in the communities in which we work. I'm an optimist at heart. And while I recognize that the COVID-19 pandemic has caused great suffering to us personally and to members of our communities, I believe that this pandemic has some silver lining. It has brought into full relief the deep health inequities in our communities, but it has also brought the knowledge and opportunities to better address these inequities as well. The work we do in global health research and practice has never been more important. That might sound trite, but it certainly feels true to me today. You all have shown tremendous character over the past 2 years, and I have learned a lot from you. With that said, I hope you will allow me to leave you with a few pieces of advice. The first is to be true to yourself. This may be the most important skill I learned in grad school. And it's a skill. You have to practice it to believe in yourself. You have a world of evidence now that you can achieve great and difficult things in the face of adversity. So believe in yourselves that you will do it again and again. I would also like to urge you to believe in our institutions, namely our public health and global health institutions. They have been damaged during the pandemic. Whether it be US CDC, China CDC, the WHO, or any number of other organizations that work in earnest every day to improve our health. Trust in these institutions with eyes open. Recognize their strengths as well as the ways that you can help them to improve. The term institution was recently defined for me as simply the shapes and structures of our common life. Our common life. We need each other, and we need to work together to solve the greatest health issues of our time. The third is to be humble and to listen especially closely to those people with whom you work and who may not have a voice as strong as your own. The journalist and PBS NewsHour anchor Judy Woodruff spoke at Duke recently and said, be in listening mode. Be open, don't think you have to have it all figured out. And finally, I hope you can continue to embrace change in your lives. As a professional epidemiologist and a hobbyist statistician, I am admittedly not that comfortable with uncertainty. I can't always model out the uncertainty in my life, and so I try to lean into it as I can. Embrace the fact that we do not always know what lies ahead, and we cannot control most things in our world. I have had several important decisions and crossroads in my own personal and professional life recently. I was texting with my wife a few weeks ago related to one of these difficult decisions. She wrote to me that she was reminded of a quote that she loves, many of you may be familiar with. It is to edit your life frequently and ruthlessly. It is your masterpiece, after all. I urge you to share this masterpiece with as many people as you can. Say yes more often than you say no, and ruthlessly and frequently edit your life in a way that brings meaning to yourself and to those around you. Congratulations on this extraordinary achievement. Thank you. Now I have the great privilege, of welcoming our student speaker, in addition to being a brilliant, sorry, I can't resist, Nora, a brilliant and hardworking scientist. I am proud to say she is also a burgeoning nutritional epidemiologist. She also makes everyone and everything around her feel a little warmer, a little better wherever she goes. Nora.
Thank you, Joe, for your kind words. So good morning, ladies and gentlemen. I want to start by thanking you for being here despite these hard times COVID-19 has inflicted upon us. Then I would like to thank you, my classmates, and DJHI for giving me this opportunity to share my experience with you all. Now, what I'm about to say is highly personal, but it's going to be relatable to every one of my classmates who have had their own journeys to get here. Before I joined Duke in 2020, I was terrified because I'm an international student. I've had to travel from the other half of the world to get here. I am a Palestinian from Lebanon, or to be more specific, I'm a Palestinian refugee living in Lebanon. Now, I have a travel document instead of a passport, and unfortunately, there are unjust and cruel political regulations that do not allow me to go back to Palestine. All that to say, that yes, I was very excited to begin my journey here, but I was mostly anxious. I was nervous. I was terrified of not fitting in. I was intimidated by Duke's prestigious name. But then I actually joined Duke, and soon I became a part of this beautiful family. I was given the space to express myself. Everyone was so open and receptive and wanted to learn more about who I am, about Palestine and Lebanon as well, such as the struggles that Palestinian refugees face in Lebanon, such as simply not having the ability to vote. And also the current economic inflation in Lebanon or the explosion that happened back in August 2020, which is all very unfortunate. And as much as they learned from me, I learned from everyone. I have never experienced such diversity in one place like this. So I've grown so much as a person, and I learned so much about the world here at Duke. And I gained such an enriched cultural experience because of the wonderful relationships that I built here in the past couple of years. And here I also have to mention one of my favorite quotes by Dr. Maya Angelou. In diversity, there is beauty and there is strength. And at DJHI, seeing how our uniqueness and our differences created this beautiful dynamic environment where we all just grew together. And I can tell you from personal experience that not every place is so welcoming. Although most of my professors and peers back at AUB were incredible, and I'm very appreciative of them, I have had one professor at the faculty other than mine tell me that I cannot achieve my goals in life no matter how hard I try, to know my place and to limit my ambitions by telling me that I should play it safe. But guess what? I do not like to play it safe. I am a hard worker who has faced many obstacles in her life, but I'm also a living proof that when presented with the right opportunities and surrounded by supported family, friends, mentors, professors, folks like me can and should dare to disrupt the status quo to achieve beautiful things in life. And that is why I would like to thank DJHI. I would also like to thank my mentor, Melissa Kay, my advisor, Kate Sullivan, my professors who soon became friends, like Liz Turner, Larry Park, Joe Egger, Jennifer Headley, Dr. Boyd, Minna Silberberg, among other esteemed professors who have been very supportive. I would also like to thank the Amjad and Suhab Saiso Foundation for funding part of my education and for being very supportive. And I would also like to specifically thank Dr. Mary Story, who has been so great, very helpful and supportive, and I'm very grateful and appreciative of her. So thank you. I also want to thank my friends who became more of a family to me, because we all came in as the Zoom cohort and forming real bonds was really hard for all of us. But we were resilient and perseverant. We planned out weekly, but very COVID safe hangouts. And what was really beautiful was that we again all wanted each other to grow. And so we helped each other grow. And then we supported one another. So I'll never forget our weekly Biostat study groups, or as we call them, our weekly nagging sessions. I'll also never forget our game nights or our trips to different states. I'll never forget our state fair trip, which was my first state fair trip ever, and it was great. So yeah, we just created so many beautiful memories in the past 2 years, in spite of all the struggles and barriers of COVID. And this is something that I'm gonna carry with me forever, and I'm gonna cherish this forever. I also want to thank my family, May, who flew from halfway around the world to come see me today. Finally, I'm also going to look at the camera because my parents and my entire family, they're looking at me because they couldn't come here. So I want to thank them. I want to thank my dad, my mom, my siblings, Ahmed, Mahmoud, and Lean, for trusting me, for showing me how to love others and give back to others without expecting anything in return. I'm getting emotional. They've been so supportive. Thank you for being supportive, and thank you for being my backbone and my support system and the ones that I can turn to no matter what. So I love you and I owe it all to you. And above all, I owe everything to Allah subhanahu wa ta'ala. But what I've learned most from all the people that have loved and supported me is that life is not always sunshine and rainbows. It's also full of whirlwinds and tsunamis. So it's very important to focus on the former, but also make use of the latter to grow, because you want to be able to look at yourself in the mirror in 10 years and say that I have made it and I am proud of myself. Thank you. And now this, yes, was very emotional. I love you. And now, just for something extra, I would like to present on the behalf of the graduating class of 22, the Student Appreciation Award. This award goes to one of our advisors, Kate Sullivan, for all her support. Yes. Thank you, Kate, for being supportive. Thank you for your guidance and for your care. You've been wonderful, and we all appreciate you so much and all your efforts. Yes. So would you like to come up to stage to get your award?
Congratulations, Kate, and thank you, Noor, for those inspiring words and for being such a valued member of the class. My congratulations to you and your fellow graduates for your remarkable achievements over the past 2 years. I'm Nathan Thielman, and I'm Director of Graduate Studies at DGHI. Today, I have the pleasure of presenting our Student and Faculty Awards. And let me say that with so many outstanding students and professors in this program, it's quite challenging to choose just one student and one professor to honor. We are privileged to work in a community where excellence abounds. But the two individuals we will honor today are truly exemplary for their talent, their effort, and for their passion for global health. Our first award is the Madeleine Boccuzzi Outstanding Graduate Student Award. This award is named in honor of Madeleine Boccuzzi, who graduated from our program in 2013 and was unanimously chosen as the most outstanding student that year. Tragically, we lost Maddie to cancer in 2014, but during her lifetime, she exemplified the spirit and dedication this award recognizes, and we are proud to continue to celebrate her legacy by presenting this award in her honor. For this award, we ask our faculty to nominate students whom they believe have excelled in the classroom, in collaborative research, and in building the global health community at Duke and beyond. We received many glowing nominations. Faculty cited many examples of our students' outstanding work and especially their resilience and adaptability in the face of travel restrictions and other changes due to that which shall not be named. This year's outstanding graduate student embodies the passion and commitment that Maddie displayed throughout her life. She stands out not just as a thorough and detail-oriented student and researcher, but for her leadership and commitment to building up her peers, as well as the global health community at large. In her research, this student has brought focus on the barriers and challenges faced by parents and caregivers who purchase food through the Federal Nutrition Program for Women, Infants, and Children, known as WIC or WIC. She played an integral role in developing new research on the impact of federal nutrition assistance programs, including examining the impact of the pandemic on families who need food support. This student is also widely recognized as an outstanding leader and initiator. She co-founded the Duke Nutrition Society to bring together students from across Duke to promote health and wellness and raise awareness of evidence-based nutrition information. She is co-president of the Duke Global Health Graduate Student Association and is known by her peers to be a trusted friend and confidant whom many have sought out for advice in times of need. Describing her work as a teaching assistant, one professor writes, "She has shown incredible leadership and maturity in her role and has gone above and beyond in her care and support for her student colleagues." And another nominator remarked, "She has a generosity of spirit that is among the strongest I have seen at DGHI. She is kind, warm, friendly to all, and never makes anyone feel less than herself." For all these reasons, we are proud to present this year's Madeline Bokuzi Outstanding Graduate Student Award to Noor Hamad. Noor, please come back to the stage to accept your award.
Picture.
And now we will present the Global Health Graduate Professor of the Year Award. We are fortunate to have a remarkable group of professors and mentors inspiring students like Noor and her classmates to achieve the great work they do. These professors teach the 6 core courses in the Master of Science curriculum and elective courses across campus. They also serve as research mentors for our students, helping them design and carry out research projects that can involve multiple global partners and complex research methods. Each year, we ask students to put forward nominations to recognize one faculty member who has gone above and beyond to teach, to mentor, and to support our students. This year's winner is praised not only for his excellence in teaching and mentoring, but for his extraordinary efforts to create bonds among our community during a time when many of our usual ways of interacting were disrupted. This professor teaches courses in beginning and advanced epidemiology and also works one-on-one with students on their research projects as part of DGHI's Research Design and Analysis Core. Students say he consistently goes above and beyond to make classes both useful and enjoyable, including encouraging student-led discussions and tailoring lessons to students' individual goals. He's also been known to hold class in the Duke Gardens to help students recharge and release stress. Students describe this professor as a kind and patient person, taking time to ask them about their career goals and development. As one student writes, he really cares about helping students succeed and does everything in his power to make students feel confident in their abilities. I could not have asked for a better mentor. Nominating students also appreciated this person's efforts to check in on students during the pandemic and to foster connections among the community. Many here know him as the organizer of informal pub nights, which have been instrumental in helping students bond with peers and professors. In the words of one regular pub night attendee, I feel a much stronger tie to the people of DGHI, including other students I met here as a result. And so our Global Health Graduate Professor of the Year is Dr. Joseph Egger, Associate Professor of the Practice of Global Health. Joe, congratulations and please receive your award. Well, again, congratulations to our awardees and thank you for your outstanding contributions to our community. Now it's time to honor our graduates, and so I will ask Laura Bai to come to the stage to begin our recognition ceremony.
Shall we dance? Good morning. It is my absolute pleasure to present. Nora, it's your fault. It's my pleasure to present this Global Health class of 2022. Starting with Veronica Bertek. Studied the associations of adverse childhood experiences with key health outcomes for Tanzanian youth living with HIV. Her mentor was Dorothy Dow. Vanessa Claremont. Vanessa explored caregiver adolescent communication about sex in South Africa. Her mentor was Tierney Richwood. Ching investigated the impact of the COVID-19 pandemic on tuberculosis treatment for migrant workers in Shanghai, China. Her mentor was Shenlang Tang. Nathan completed a data-driven subtyping of type 2 diabetes using a cluster analysis of the Malaysian National Diabetes Registry. His mentor was Rachel Nugent at RTI International. Jean Gleason. Jean explored the attitudes and behaviors related to gear cleaning among North Carolina firefighters. Her mentor, Noor Hamad. Noor performed a qualitative analysis to develop a pilot intervention for improving diet quality and increasing redemption of WIC-approved foods. Her mentor was Melissa Kay. Zoe performed a health financing policy analysis regarding universal health coverage for the poor in Africa. Her mentor, Isabel Kennedy Mitten, co-analyzed how health system strengthening can lead to self-reliance through outcome harvesting in Togo and Guinea. Her mentor was Leora Miller at Results for Development. Mago Mansour. Mago evaluated a virtual family strengthening program during COVID-19. Her mentor was Eve Puffer. Melissa Marchese. Melissa examined the neurodevelopmental effects of PFAS exposure through drinking water. Her mentor was Li Peng Fong. Alyssa Martinez. Alyssa analyzed hopefulness among individuals in Tanzania living with schizophrenia and their caregivers. Her mentor was Joe Egger. Murphy. Ronan conducted a qualitative study exploring the design of a new pandemic vaccine system. His mentor was Gavin Yamey. Dorothy Nam. Dorothy studied the facilitators and barriers to sickle cell disease education among youth in Kalangala, Uganda. Her mentor was Paris. Alexa Namasnik. Alexa investigated the intersection of gender and teacher well-being in Cambodia and Kenya. Her mentor was Regine Preshold-Bell. Shanti Narayanasamy. Shanti explored how faculty trainees and medical students operationalize race in medicine. Her mentor was Charmaine Royal. Don conducted a pre-pandemic viral surveillance of swine in northern Vietnam. His mentor was Larry Park. Sarah O'Malley. Sarah studied the seasonality of fish production as a potential predictor of malaria transmission in the Peruvian Amazon. Her mentor is Bill Pan. Elena explored the impact of gender on alcohol use in Moshi, Tanzania. Her mentor was Catherine Staten. Sai Nikita Pratapati. Nikki studied myocardial infarction in people living with HIV in northern Tanzania. Her mentor was Julian Hertz. Charla is studying trends in perinatal outcomes in Brazil. Her mentor is Nathan Thielman. Cao Tian Run. Cao Tian is working with Tazeen Jafar to explore blood pressure control and healthy lifestyle promotion through a multi-component intervention in Singapore. Colin Smith. Investigated the association of Black race with physical and chemical restraint use among patients undergoing emergency psychiatric evaluation. His mentor was Nathan Thielman. Shivani Sarati. Shivani explored how to create a financially sustainable virtual healthcare platform for maternal healthcare in the United States. Her mentor was Nick Pearson from Birth Compass. Catherine Thomas. Examined the program management and implementation of HIV/AIDS prevention programs in Eswatini, Niger, and Uganda. Her mentor was Lonnie Marquez at URC. Madeline Wilkinson. Madeline Evelyn studied the associations between self-stigma and emotional well-being in orphans as part of a multi-site study. Her mentor was Christine Gray. You may assess the capacity and planning of COVID-19 vaccination sites through a mathematical and simulation approach. His mentor was Shenlang Tong. Sophia Zavala Munson. Sophie examined the testing of non-US born persons to improve diagnostic accuracy of latent tuberculosis infection. Her mentor was Nathan Thielman. Hannah worked with Antonio Powell at John Snow Inc. to measure person-centered care for tuberculosis in a multi-country project. Please join me in congratulating all of our graduates. Can I ask the rest of you to remain seated while our graduates recess? Graduates, please rise. Lisa will dismiss you by row, and please follow her and the rest of your classmates out to the back steps for a class photo. And for family, friends, and supporters, we ask you to, you're all welcome to please join us for a reception in the atrium after the graduates have left the hall. Thank you so much for celebrating with us today.
Very efficient.